Good day, ma'am. I am April Grace Quesado, together with my partner Kate Nicole Untalan, and today we will explain the NCP that we formulate using the case scenario number 1. Maria Lopez, 28 years old, gravida 3 para 2, 39 weeks, spontaneous vaginal delivery, prolonged third stage of labor, which is 30 minutes. She has a history of preeclampsia and a previous postpartum hemorrhage with her second child. So we will start in the cues, which is the subjective and the objective cues. We have here the subjective cues. I'm soaking through a pad every 10 minutes as she verbalized. Next is the objective cues. We have the blood pressure of 90/60, the heart rate of 110, the respiratory rate of 32, fundus is baggy on palpation, uterus is at the level of the umbilicus, hemoglobin of 10g/dl, and hematocrit of 36%.
The primary needs of the patient is physiological needs, as she is experiencing excessive blood loss due to postpartum hemorrhage. Adequate blood volume is essential for oxygen transport and organ function. If the bleeding is not controlled, she may develop hypovolemic shock, which can be life-threatening. Immediate intervention are necessary to restore blood volume, stabilize vital signs, and prevent further complications such as shock and infection. For our nursing diagnosis, the patient is risk for deficient fluid volume related to postpartum hemorrhage, secondary to uterine atony as evidenced by excessive vaginal bleeding, low blood pressure, elevated heart rate, elevated respiratory rate, and a baggy uterus. So the rationale for this is the postpartum hemorrhage is a significant cause of maternal morbidity and mortality. Uterine atony, the failure of the uterus to contract effectively after delivery, is the most common cause of postpartum hemorrhage. This condition can lead to excessive blood loss, resulting in hypovolemic and hemodynamic instability.
Next is the objective of care. After the 2 hours of nursing intervention, the patient will have stabilized vital signs within the normal range, maintain adequate hemoglobin and hematocrit levels, prevent hypovolemic shock, show no signs of infection, and communicate need in an effective manner. Next is the intervention. First is the established rapport. Rapport helps gains patients' cooperation and active participation in therapeutic communication. Next is monitor the blood pressure, the heart rate, the respiratory rate, and the temperature every 15 minutes until stable, then every 30 minutes. The rationale for this is monitoring vital signs helps in early detection and management of postpartum hemorrhage. Next is initiate IV access and administer fluids as prescribed to maintain adequate blood volume. The rationale for this is fluid replacement and blood transfusion, if needed, helps in maintaining adequate blood volume and preventing hypovolemic shock. Next is monitor signs of infection like fever, foul-smelling leukia, and etc. Rationally, preventing infection is important due to the increased risk associated with prolonged labor and invasive procedures. Lastly, educate the patient on the importance of reporting any excessive bleeding and signs of infections. The rationale for this is patient education ensures that the patient is aware of the signs and symptoms that needed immediate medical attention.
Evaluation. After 2 hours of nursing intervention, the goal has been partially met as evidenced by first, the patient's vital signs improved toward baseline, her blood pressure stabilizing, her heart rate and respiratory rate is returning to normal range. Next, vaginal bleeding has been slowed down, now soaking a pad every 30 to 60 minutes instead of every 10 minutes. Next is the uterus is now firm after continuous uterine massage and medication administration. Next, there are no signs of hypovolemic shock have been developed, no sign of infection have been observed. Next, the patient verbalized understanding of her condition and the importance of monitoring excessive bleeding, saying, "I feel more comfortable and reassured about my condition," as she verbalized. Through prompt nursing intervention, we were able to stabilize the patient, control the bleeding, and prevent further complication. Also, the goal has been partially met. Continued monitoring and patient education remain essential to ensure full recovery. This case highlights the importance or crucial role of nursing care in managing postpartum hemorrhage and emphasizes the importance of early detection, timely intervention, and patient-centered care in preventing life-threatening complications.